Hello, everyone, and welcome to our COVID AMA. I'm Salt Lake City Mayor Erin Mendenhall, and joining us today is Dr. Angela Dunn, our state epidemiologist. Thank you for being here, Dr. Dunn. If you have a question for us, please drop it in the chat, and we're going to do our best to answer it in the next hour. So let's get started with the questions that people have for us around the pandemic. The first question is, Salt Lake City has a mask mandate. Does it seem to be working? And why is it important to wear a mask? I'll hand this to Dr. Dunn, but start by saying that it's a Salt Lake County mask mandate, and we have seen a decline in the new case numbers since that the beginning of the mask mandate was put in place. And we feel really positive about that, and the data helps to support it. Dr. Dunn?
Sure. I mean, definitely masks work. As Dr. Good from the University of Utah said, masks are our medicine right now against COVID-19. You're right, Erin. When the mask mandate went into place, exactly 14 days later, we started seeing a sharp decline in our cases, and that's continued ever since. And other counties and cities have followed suit behind Salt Lake County with the mask mandate, and we know that that is contributing to the decreased spread.
I'll just add that masks need to be depoliticized. It's not a political statement, and they shouldn't be a political statement. If we're really interested in reopening and rebuilding our economy, we have to take this mask wearing seriously. And it's the fastest path that we found so far back to being able to go back to life as normal. All right. Question 2, why is it important to look at the data on a week-to-week basis rather than day-to-day? Dr. Dunn, I'm not going to pretend that I have a better answer than you on that.
Yeah, so there are a lot of things that cause fluctuations in how many people get tested every day and the number of cases every day. So this far into the outbreak, it's really important that we focus on the trends. At the public health side, we're focusing on 7-day averages. So that really allows for that fluctuation between the weekend and various things and holidays happening during the week. So we can compare the 7-day trends over time to really get a good picture of where we're headed with the outbreak.
Dr. Dunn, while I wait, oh, actually, there's the third one, but can I do an add-on question to that? Over the last week, if you look at Salt Lake County's data, you'll see a pretty good decline, but there's 2 high days. What do you do with these seemingly anomalous spikes that come up amidst what seems to be a consistent trend?
Yeah, absolutely. So while we are following the 7-day rolling averages, whenever we get an anomaly of 1 or 2 or 3 days of a spike, we look into it to see, have there been any specific outbreaks in the area? Is a different population at greater risk? So we try to figure out if there is a reason, or is it just on that day more people happen to get tested? So we look into all of those anomalies and hope to see the trend go down after that, which is what has happened in Salt Lake.
Thanks. The next question is, when will we move to yellow status? I'll take that one, and perhaps Dr. Dunn has some insight as well. But the status of being in yellow, which Salt Lake City's been in, as you know, since the beginning of May, I believe I'm right on the May 1st timeline there, is in place because we are looking, the orange status is in place while the rest of the state moved to yellow at the beginning of May. We've been looking not just at the aggregate of all of Salt Lake City's data, but because we have some of the hottest spots in the state. And right now that's improving somewhat, but they're still elevated. And that's 84104, 84116, which is basically the western half of our city. And this part of our city has the highest per capita of kids in all of Salt Lake City. And it also is one of our most diverse populations. And there's been a lot of data, even just recently, about how much or what a disproportionate impact our people of color, Hispanic population, Pacific Islanders, Black and African American have been harder hit. And I know that Dr. Dunn is working with our county public health officials trying to increase testing opportunities, increasing the outreach. And I've recently asked the council to support $50,000 for supporting the community health connection folks who are working with people who've been tested positive to make sure they have all the resources that we can to support them and their families. And that's what we're going to keep looking at, is for the half of our city that's been the hardest hit and continues to be the hardest hit compared to the rest of our city. I'll say early on and consistent. Dr. Dunn is really consistent. I love that about her. But she's been saying, and the CDC talks about looking at the 14-day, not a short piece of time, not a day, not a week, but a 14-day trend. And although Salt Lake City has been on the aggregate in a pretty good decline over the last 30 plus days, these numbers are still quite a bit higher than we would like to see. And the rate of decline isn't great in 84104, 84116, although it does seem to be stabilizing. Dr. Dunn, do you want to add anything?
No, I completely agree with you, Erin. I mean, I think we really need to pay attention to the communities that need our help most. And that's exactly what we're doing with the community health workers, targeting populations and communities that might need a little more help in quarantine and isolation. And I should be saying Mayor Mendenhall, I apologize. I'll be more formal.
It's okay. I'm not that formal myself.
You are my mayor, though, so you deserve that. I apologize.
No need for an apology. Our fourth question, are business needs being placed at the same importance as public health? I'll start on that one. We, as a city, I think it's that's unique. I haven't thought of these as apples to apples, and public health and public safety are, for me, a greater priority than the other very important and legitimate focuses of any city, the economy included. And they're also inextricably linked, and we know that. So we are directly investing as a city in the ability of our local businesses to make it through this pandemic. We were the first city in the state to do an emergency loan program when the pandemic began, and cranked $1 million out to just over 50 businesses, which we really saw as gap funding to while we waited for the federal dollars to come online. We've continued to work directly with our small and local businesses, and we recognize that federal assistance that came along was great while it lasted, and it's starting to fall off, and the impact on these small businesses is very cliff-like when that funding runs out. And now that they've accessed federal funding, they can't have any more CARES Act dollars. So I'm working with other city mayors, capital city mayors across the country, in trying to communicate with our Congress people as they do hopefully another update to the way that cities can spend those CARES Act dollars that allows us the flexibility to continue to support our small businesses. And in case you didn't know, 90% of the business licenses issued in Salt Lake City proper are small businesses. 90% of our businesses. That's 50 or fewer employees. So that's the bread and butter, not only of our economy, but it's our people. It's where we work. It's the employers of our neighborhoods. So they are inextricably linked. We're doing everything we can to keep our businesses afloat and make sure that they are the path to our economic recovery. Dr. Dunn, anything you want to add?
No, I completely agree. I mean, it's not an either or. We know that health and physical health and economic health are linked very, very tightly. So it's something that we've been prioritizing from the beginning of this pandemic, is how to protect everyone's health, but also mitigate the economic strains that inevitably will follow from some of the health measures that have been put in place.
Great. Our next question is, are you concerned about fall contact sports and teams all wearing gaiters?
So, gosh, there's just still so much we don't know about COVID-19 and how it spreads, especially among our young population. And a lot of that is because schools close so quickly. So we are learning from other countries, what they've done and how they've engaged in school and extracurricular activities safely. We are definitely expecting to see cases due to schools and extracurricular, and we're reaching out to schools and team sports and organizations to make sure that they have all the information that they need in order to keep staff, coaches, players, and students safe. Gaiters specifically, there's not a lot of data out there on kind of which mask works best. So it's really important that it just fits really snugly across your nose and your cheeks and secures under your chin. And that will minimize the amount of droplets that go out into the world and potentially infecting other people.
Thank you. Our next question is directed at you, Dr. Dunn. If someone tests positive, I understand that they need to retest over the coming weeks until they are no longer positive. Is it true that each of that person's tests are included in the positive test counts that are subsequently reported?
Sure. So there are a couple things with that comment. The first is no, we deduplicate all of our cases. So the numbers that appear on our website for the case counts are all individual cases. You are not counted as another case unless you test positive 90 days after your first positive. So any other positive test that happens within that 90-day window is not counted again. And we haven't had any people test positive after 90 days that would, maybe indicate a reinfection. So that hasn't happened. We definitely deduplicate. The other piece of that, though, is that at the very beginning of this outbreak, it was recommended that people test negative. However, we don't recommend that anymore for a variety of reasons. It is a symptom-based clearance. And so if you test positive and you isolate for 10 days, 24 hours have to pass of you being fever-free and your symptoms improving, and then you're able to be released from isolation.
Great. Here's one for us to take head on. How come you're ignoring the studies that masks do not protect against COVID, but are actually causing harmful side effects like significantly lower oxygen, tooth decay, anxiety, carbon monoxide poisoning, etc.?
Yeah, so we have a school health task force that includes experts from around our state, that includes infectious disease pediatricians and adult physicians that are actually assisting in the national guidance and response on this. We have them right here in Utah, and they've worked with child developmental specialists and other experts in that field to really understand the negative side effects of wearing masks, even for long periods of time. And really, the evidence shows that masks work. They prevent COVID-19 spread up to 80%, and there's very minimal negative side effects. So if you think that you or your children potentially have negative side effects due to a mask, I encourage you to.
We'll give it a second. Well, I'll move on to the next question while we wait for Dr. Dunn's connection to get better. Let me see. Okay, Salt Lake has some of the hardest hit neighborhoods for COVID, right? What has and is being done to mitigate that? Great question. And we talked about it a little bit before, but I'll jump in that there is no doubt that there's a disparity in the people and the area codes that are most impacted by COVID. And that has to be addressed with really targeted and specific strategies. I'm grateful for Dr. Dunn and her incredible guidance and her authenticity in presenting the facts to not only the governor, but to the rest of us at the city level. And of course, our reliance on the county health department. So the state, the county, and the city are working closely to prioritize these strategies. We have put obviously I mentioned our continued recommendation of staying in the orange risk level is really focused on 84104 and 84116. That provides the highest level of protection at this point that we can get to those hardest hit areas. I recently put forward that budget recommendation for $50,000 for the Association for Utah Community Health. And that's the entity that does that extensive outreach with people who are testing positive, and whether it's that they need rental or mortgage assistance, they need food delivered, they may need to connect with Department of Workforce Services, whatever those financial support tools are or other tools that their family may need, this is funding for that. So the council's considering that right now in the budget amendment. And then we'll continue to try to increase our testing availability in those areas with the county and the state. We're deploying those community health workers and trying to support those efforts with the county, distributing masks. We've funded quite a bit of masks, and there's also a request in this budget amendment for clear masks for hearing impaired in our community, which, interesting note, 13 to 17% of any community has community members, or 13 to 17% of a community are hard of hearing. So being able to see what I'm saying is a key to understanding and communicating and functioning. So we have a budget request in there about that as well. I think Dr. Dunn, welcome back.
Sorry about that. I thought everyone else went offline, not me. So I kept talking.
Happens all the time. I'm going to mention one more piece about our west side, our hardest hit area. And that is getting culturally relevant, sensitive information out. So Salt Lake City, my office started multilingual PSAs in April. And we do a dozen different languages. And this is just trying to increase, we do them in a video format so that even from a literacy level, they're accessible. And we've increased pretty dramatically our contact and weekly engagement with Spanish-speaking radio and television. So just trying to get accurate, up-to-date information as easily accessible as possible to those parts of our community that have been the hardest hit. All right. Question. I didn't see another question. Oh, there's one. Can we get COVID test results within 48 to 72 hours for travel to states requiring a negative COVID test to enter without quarantining?
Yeah, so this is becoming more and more popular of a request as people are wanting to travel a bit more. We do encourage you, if that fits, you first should talk to your healthcare provider to see if they have the ability to get you tested and recommend that. The other option is to go on our Test Utah website and fill out, there's a questionnaire on there, and it does ask if you need it to travel. So with regards to turnaround time, if you get tested from a laboratory here in Utah, the average turnaround time is around 2 days. And so that definitely will work. But the challenge with getting a test to travel is that isn't currently covered under the federal insurance mandate to cover testing. So currently the federal government requires insurances to pay for testing if it's medically necessary. So if that is something you need, I encourage you to talk with your healthcare provider and your insurance company about what you might be required to pay for.
Great. I love this next question, and I will join in on it as well. How can we buy you a thank you drink, Dr. Dunn?
As soon as this is over, I'll tell you where I'm at, and everybody can come.
You have done an extraordinary job. And I know that your history, there was a really great profile piece on you in the Tribune, was it? In the Tribune a couple of months ago. If the listeners didn't get a chance to read that, you should look it up. Go Salt Lake Tribune did a great profile piece on Dr. Dunn and her really impressive, incredible history. But I think most impressive is your tenacity. And we need that and your brutal honesty through this crisis. It's been a wonderful combination, and I think brings a lot of comfort to us as residents of the state that we're hearing an honest take on where we're at, and your lack of political lens when you communicate is really needed too. All right. Anything you want to tell us about what your day-to-day life is like? Are you working from home?
Sure. I am today. Usually I go into the office. There's a handful of us that go into the office, pretty much the core leadership team at the Department of Health. We're all wearing masks, even in the conference rooms. And we get our temperature checked on the way in. Even still, most of our meetings are by video conference. But the day is varied, as you can imagine, from talking with local health departments and local elected officials about certain orders or recommendations, which today we did this morning about the new school mask mandate or health order that went out, to dealing with COVID in mink, which is another thing we have going on, and have a CDC team out here. So there is a lot of variety that goes on in my day. Makes the days go by fast, but it's fun.
Great. We're glad you're well too as you go through this. Next question. What if people need help paying their rent or mortgage? Oh, great question. And we absolutely know that our residents before this pandemic, needed help at many times paying rent and mortgage, as about half of Salt Lake City's population are renters, and about half of that population are spending more than they could afford on their rent, which is whatever you make. If you spend more than 30% of that on your housing costs, then you're technically housing stability compromised. So this was a crisis before the pandemic. Salt Lake City, recently in a budget amendment, we put $1.1 million toward rental mortgage assistance and rapid rehousing. It was about 750, 200-ish, and about $100,000 for rapid rehousing. The 200 was for 250 for mortgage. We have over a $9 million package, support package, that we are rolling forward in addition to that. And that's to help people stay in their homes, as we don't know when this will end. And we know that the economic impacts will definitely outlast the time before we have a vaccine or after we have a vaccine. So we are working on everything from the homeless end of the structure. And I think it's good to mention that the county has received CARES specific dollars to support homeless services and homeless needs that have been exacerbated or created by COVID. So the county's focused with their dollars on that, but we are also working with through that partnership to try to not only take care of our residents who are experiencing homelessness, but prevent people from being faced with that as they face evictions. Dr. Dunn, I don't know if you want to talk about housing, but we've got another question.
Yeah, go ahead.
How much does comorbidity factor into the coronavirus death numbers? Is it true that you could have someone with coronavirus die in a car accident and have it count as a coronavirus death?
Yeah, so, I'm glad you asked this, because a lot of people have this same very question. So our coronavirus death counts on our website are people who pass away who are test positive for COVID-19, and their death is due to COVID-19. So the example that's presented here, where someone dies in a car accident and then happens to also be positive for COVID-19, they would not count in our death count. So sometimes what happens, and this has happened a couple times, a handful of times, our medical examiner for the state will see a death and say, that death needs a little more investigation. I'm not convinced that COVID contributed to the death. And the medical examiner will look into it in more detail. So I am really confident that all of the numbers that are on our website, those deaths are due to COVID-19.
Thanks, Dr. Dunn. I want to jump back because I failed to offer the connection point for residents who might need help with their rent or their mortgage. And residents can call 211. That's, of course, run by the United Way. And that will connect people with city funding that we're working through to connect with, like the CAP program and other nonprofits that normally distribute that kind of assistance. And also connect residents with the $20 million that is statewide, that the state put through just in June for statewide mortgage and rental assistance. So 211 is the great connector. Please remember it, share it with anyone. And the rental and mortgage assistance is going to continue as far as Salt Lake City is concerned. All right, our next question. What is being done to organize any programs or specialized COVID clinics for the long haulers, those who have been struggling with the debilitating post-viral effects for weeks or months? Are there any current options for support for them? I'll just notice or mention, Dr. Dunn, and I hope you have some information on that $50,000 for the Community Health Connection team that the city is looking to support in the current budget amendment would be a great, those community health workers can work with people no matter when you tested positive, and if you're continuing to experience effects, that's a great support for people.
Yeah. So, I don't know of any specific programs offhand, but I do know that our healthcare systems are focused on understanding and helping people with the effects of COVID that we know for many last longer than just that kind of acute couple-week phase. So that is something our health systems are doing. I just don't have the details off the top of my head.
Great. Is the viral load changing? It seems less sickness or maybe people are not getting as severe an illness.
Yeah, so what we've seen over the past couple of months, and this is similar to what we've been seeing nationally, is that the age of the people that are getting infected seems to be dropping. So younger individuals are getting infected with COVID-19, and we know that younger individuals are less likely to have severe disease. And so just this past week, we've seen a drop in our hospitalizations, and that is likely due to the younger age being infected right now.
Yeah, Dr. Dunn, you and I spoke recently also about how the Southern Hemisphere that's kind of coming out of winter time right now and flu season, there's really pretty clear indicators that if you are wearing masks or the areas that have mask mandates and mask participation have lower flu rates, and those that don't are having that compounded effect of not only COVID growth, but flu growth.
Yeah. Yeah, I mean, absolutely. As we enter into the fall season, I mean, the flu vaccine usually becomes available at the beginning of September. So, in just a few short weeks, everyone should really focus on preventing as much flu as we can because our healthcare systems really can't handle flu on top of COVID. So, mask wearing, physical distancing, and of course, the flu vaccine will certainly help with that.
Thanks. What are your plans with implementing the COVID vaccine? This is probably mostly Dr. Dunn, but I will say that this is probably a no-brainer for Utahns listening, but it is a unique situation for a city to be in, dealing with such a tremendous impact on our residents and our economy as the pandemic is. And yet we don't have a health department. That's at the county level. And so there's not a mayor in the state who has health department employees who can, process the data this way or that way, or present for the mayor and help a mayor to understand whatever that mayor might be asking for. It's really unique for cities, and the county has been a great partner in helping us to get as deep as we've desired to, and looking specifically at our hardest hit areas, for example. But it's a really unique place. So as we look at the planning for virus distribution, we want to be intrinsically involved with the county as they plan for how to roll this out, how to make it accessible, how to make it feel safe in all of those ways that our residents, we know, particularly Black and Indigenous and people of color, who may not trust a process that the government is putting forward. There's so many ways we need to make it safe and accessible. And the city is prioritizing this, and we'll work with the county to make sure we do the very best that we can. Dr. Dunn?
Sure. So the COVID vaccine will be distributed at the federal level. And right now, they are determining how they're going to do that. So when H1N1 was here, they distributed it all through public health departments. And they're looking at a little different model this year for COVID-19 vaccine and doing some through the public health departments and some direct to health systems. And so that model is still to be determined. At the state level, we do have a group of all of our stakeholders that is already meeting regularly because we know when we get the vaccine, we won't have enough for everybody. So prioritization is going to be key this winter when the COVID vaccine comes out initially, before we have enough doses for mass vaccination. So distribution by the federal government is the first piece, and prioritization. So who will get those first doses are really the things we're planning for right now.
Dr. Dunn, do you think, this is a question from Erin, that the potential for a shift in the presidential administration could affect those post-November plans? Assuming there isn't
I hadn't even thought of that, but you're right. We're probably the only constant throughout this whole thing has been change. So you're right. All of that could definitely change. But we'll be certain to keep our stakeholders on top of it. So that's what's going on now. As things change, we'll certainly keep your office up to date, as well as the county.
Okay, where can we get tested for antibodies? And will you just talk a little bit about antibody testing and its various and sordid history?
Sure. So what antibody, no matter what disease you're testing, for antibodies for. Antibodies are what your body makes in response to a virus. So they are seen as an indicator of immunity. Of course, we don't know what that means in COVID right now because it's only been around since December. And so we don't know how long people have immunity to COVID-19. It is probably for some time, but we just don't know how long it lasts. So when you're getting an antibody test for COVID-19, it's detecting if you've had COVID in the past. The thing about the antibody test, though, is that its accuracy is highly dependent on the likelihood of you having been infected. So if you've never had symptoms, never tested positive for COVID from one of the nasal swabs, and you haven't been around anyone with COVID, if you get an antibody test, it's only 50% accurate. So it's a coin flip. So we really encourage individuals who want to know if they've had COVID in the past or if they've, have an immune response to it, to really talk with their provider about that. The way you get tested for antibodies is directly through your healthcare provider. So commercial labs can all do it, and insurances can pay for it. So it's something to talk about with your primary care provider.
Great. I think that important part of that it isn't a predictor of your future vulnerability to to COVID-19.
Absolutely.
All right, the next question, with schools in Salt Lake City starting online and online learning being a necessity now, how are we helping people with limited access to Wi-Fi or computers? Absolutely, digital divide is under a spotlight right now. And although Salt Lake City has been talking about the digital divide and made some efforts in the past, it is still a chasm where so many of our residents either just simply don't have the access because that infrastructure hasn't been made available for for fiber. My street doesn't have fiber, but I know a lot of our west side, after 6 years of Google being in Salt Lake City, we still don't have that geographic distribution of that kind of internet access. So I believe that internet access is as fundamental a public utility as other public utilities that the city provides. And it has to do with your ability to obtain an education, to work. Like literally, we're all using it right now to do our jobs, to access healthcare, to apply for whether it's DWS or assistance, to communicate with your family that you're isolated from. It is so fundamental to the way we function. So anyway, enough about a soapbox. We care about it a lot. That's why we developed Rose Park Connect. That was announced a couple of weeks ago. It's a partnership with the Church of Jesus Christ of Latter-day Saints and I believe, Salt Lake County and the city. And we created a stake center that's had some rooms transformed into internet and computer access open to the community. It's 4 days a week for a few hours each day. Even our census workers have been in there trying to make sure people who come in to use the computers have taken the census. Take the census if you haven't. And it's been really positive. So we requested, in addition to that, in this current budget amendment with the council, and you can go check it out, it happened on Tuesday, some pretty good funding, $75,000, that would allow the city to install a Wi-Fi backbone on Ensign Peak. And then that would allow us to deploy 3 mobile, basically Wi-Fi generators that could be moved in the future, but to open up access in areas where we have that digital divide. All right. Oh, and we're also partnering with SpyHop to get computers out to residents as well. Okay, our next question. If our cases are down, why is our positive case rate still high? You said it should be below 3%.
Yeah, absolutely. So in countries that have been able to go back to quote unquote normal life, their percent positivity has been around 3%. We are looking to lower that, right? That is a goal. We need to watch not only our case incidence, so that 7-day rolling average of new cases, but also our percent positivity. You want to test a lot of people to get that percent positivity down. And that means that you're catching people that are potentially asymptomatic or have really, really mild symptoms and preventing the spread of COVID-19 really early and quickly. if we're only testing people that are in the hospital or in long-term care facilities, for example, that percent positivity is going to be higher because they're more likely to have it and be sicker with it. So we really want to make sure that anybody with the most mild of symptoms gets tested, because that's a sign that we're catching it earlier and preventing more spread among the community. So as our case counts drop, which they have, and that's fantastic, our percent positivity has as well. At our peak, we were around 10 to 12% positivity, and now we're at around 8.8%. So it is declining in conjunction with our cases going down. So there's good news all around with that.
Would you talk about rapid tests? There's a question if we will get those soon.
Yeah, so we actually already have rapid tests in the state. A rapid test means that you're getting your test, within a couple hours at the most. And some can be done from a nasal swab, just like the regular gold standard test that was, available at the start of this. And some are now saliva tests. So the University of Utah and ARUP announced yesterday that they're going to start doing saliva tests. So we do already have them. However, the supplies to run those tests are limited. And so we prioritize really high risk settings. So our long-term care facilities and our hospital settings. So for example, if you need emergency surgery, the surgeons can know before they do surgery if you have COVID or not. So those types of situations are where we're prioritizing the rapid tests that we're getting from the federal government. We are, as a state, looking to purchase more rapid testing supplies and so that we can distribute them more widely. However, as with everything in this outbreak, it is a lot of demand for very little supply for things like rapid tests. So we are working as a state to get that more readily available in Utah, but it's just not there yet.
Well, I know that testing has evolved over time too. And when I was tested, just from having been around and been out at meetings early in June, that they said, oh, this is a better test up your nose than the one we used to do, where we had to swab for 30 seconds, and now it's only 10 seconds. So
exactly.
The evolution of testing is moving so quickly. It's been kind of surprising, I guess, how quickly it's evolving.
Yeah.
Hopefully we will get those tools that we need to do rapid testing more broadly. Next question is, what is being done to enforce the mask mandate? As you probably know, there have been no criminal citations, not in Salt Lake City, and I'm not aware of any in the state of Utah. I know Salt Lake County has a mask mandate, and I don't think that any have been issued there as well. We're asking people to do the right thing, and this has a lot to do with businesses self-enforcing, and most people are reasonably complying with that. Dr. Dunn, I think you have some data or some interesting statistics about when that's posted versus when it's not, and that we have a mandate in place. I'll end my little piece of this by saying most people want to follow the laws. There's always people who are not going to follow. There's people who are going to speed, people who are going to try to light up in a public place and smoke a cigarette. But most people want to do the right thing. And for me, wearing a mask, it is as much a no-brainer as putting a seatbelt on, or really more like secondhand smoke. Like I don't have the right to get you and your kids sick just because I'm in the same public space as you. Dr. Dunn?
Yeah, so we've been able to do more surveillance on who's wearing masks and where they're wearing masks and when are they more likely to do it. We know that in places like Salt Lake County, there's about 85 to 90% compliance with the masks, versus counties that don't have any mask mandates, there's only about a 60% compliance. But that's not all. So we've also watched people going into businesses and tallied whether or not they're wearing masks. In businesses that have signs posted that say masks are required, individuals or patrons of that store are much more likely to wear masks. So I really encourage all the businesses out there to put those masks out in their front door, and patrons to really adhere to those, because it'll give everybody more confidence to get engaged with the economy if we're all wearing masks, because we'll just feel safer.
Great, thanks. This next one, it looks like there's several questions inside of it, so I'll read it all at once and we'll do our best. There's a disproportionate positivity rate in the Salt Lake City West Side Latino community, which we've talked about. And this extends to the west side of Salt Lake Valley. Latino dominated communities have positivity rates of 20% or greater. Should the mayor and Senator Escamilla spend more personal time on the west side doing joint outreach there? Why did Salt Lake County Health reduce and stop west side testing? Should west side testing centers be restricted to only test Latino residents? We cannot beat COVID-19 in Salt Lake City if we cannot penetrate the positivity in the Latino community. Great series of questions. I love working with Senator Escamilla, and she's been really a wonderful advocate and done a great job as a senator in getting that community health connection work established and funded. And I've talked a couple times now about how we're looking to support that with $50,000 from Salt Lake City. Those community health connection people have the skills from a case management sort of perspective and engagement perspective, plus the training from health department on how to safely engage with community members. They have language skills that cross a number of language barriers as well. And so we're finding the right people who have that skill set to do it. But I'm always happy and open to partner with Senator Escamilla to put these big, important policies and programs in place. I hope we can keep doing that together. Why did Salt Lake County reduce and stop west side testing? Great question for Salt Lake County, but the bulk of what I heard, and as you know, they started it back up the week of 4th of July, and they stopped it, I don't know, Dr. Dunn, towards the end of June. Maybe there was a 10-day window. That was when the Fair Park drive up free test had, I believe that's the one, you can correct me, Dr. Dunn, if I'm wrong, had a majority of people from outside of the county who came to it, and even people from outside of the state who drove to get the test. And so part of the beauty of such an open testing is you remove barriers of having to show ID, which we do not want to have to do, because we have thousands of households in Salt Lake City of undocumented or mixed documentation families, and we absolutely don't want to create barriers for people in the community to be tested in that regard. So that's my opinion about whether or not we should be restricted to test only certain residents or validating residency, but Dr. Dunn might have a different opinion on that.
No, I absolutely agree. Our goal is to prevent as many barriers as possible to testing. The other piece of that is to reserving our testing capacity for Utah residents, because a lot of this is Utah taxpayer dollars at work, and we want to make sure we protect Utahns. But there is no requirement to show any ID at any specimen collection site. So everyone should feel free and open to go if they need to get tested, and they will not be required to show an ID. And yeah, we need to remove as many barriers as possible. And part of that is, of course, having access to testing through, increased hours and increased locations. And we're working on that as a state. We have now put into place state contracts with private labs that will allow us more flexibility and capacity to do testing, in addition to our standing partnerships, of course, with the healthcare systems in Utah.
I want to give a shout out to Nubia Pena at the state and all of the teams that came together with her to put together the research on the disproportionate impacts on populations of people of color in Utah. And they've done a wonderful job of articulating the qualitative and quantitative aspects of that. But from a city position, prioritizing those hotspot areas to increase our testing availability, to deploy those community health workers through the partnership that the state and the county have together. And that AUCH, that Community Health Connections, they will help patients and families with everything from filling prescriptions and providing hygiene kits and connecting them with food resources, a lot of items that aren't typically covered by traditional funding sources, like rental assistance or another connection point. So In addition to that, to the broader community, the potentially infected residents, which is every single one of us, but particularly in the Latino community, this has been a priority around our communications, increasing communications and access to the good information, accurate information, and up-to-date information. And we're going to keep doing that. And we're open to ideas about better ways to engage or additional ways to engage. I want to mention that our West Side in particular is an incredibly resilient, not a single community, but many communities there. And there are solutions that are generated by the communities themselves. You know this. And so as a city, we have come in not saying we're here to fix everything and we're going to tell you how we're going to do it, but to ask the question, how can we amplify the solutions that you are already creating on your own to get good information, to get masks distributed, to help families who are in need, whether that's with childcare or food or rental assistance? How can we amplify your good solutions? And then where there are gaps, tell us so we can work together on creating solutions. And one of the big things is childcare. So we're in that same budget proposal on Tuesday, there's a request of $1.6 million for the city to expand its youth city program. And instead of offering 3 hours after school, as we traditionally have done, this would be 9-hour childcare. It's really not, it's not a daycare. It's for 8 to 18. It is art, there's STEM, there's a lot of academics that we're building into it. So we are really working with the community to see how we can amplify and support. Oh dear, I lost Dr. Dunn again. Let's see if I have a question without her. Why do we believe COVID numbers when so many states have been busted for inflating numbers? Great question. We'll wait for Dr. Dunn. What federal assistance or funding is being offered to cities like Salt Lake City who are declaring a state of emergency? Well, the CARES Act dollars originally that went out to cities were only for cities of 500,000 people or larger, which there isn't a single city in the state of Utah that's that large. Subsequent funding from Congress has made it so that we expect to get, hi, Dr. Dunn, welcome back. We expect to get 3 tranches of $5.8 million. And we have our first tranche of $5.8 million, which is the budget amendment that I've just been talking about over the last hour. Those future ones, they're all, they go through a population formula. So the money that the counties received and the money that the cities will receive are based on our population. So even though Salt Lake City has about 200,000, another plug to take the census, we know there's more of us than 200,000. We get 200,000-ish worth of the CARES dollars, even though Salt Lake City normally doubles its workaday population, and we have to carry the public safety infrastructure and maintain the streets and have a sewer system and provide the water for closer to 500,000 people. All right. Hi, Dr. Dunn. Here's a question for you. Why do we believe COVID numbers when so many states have been busted for inflating numbers?
So I don't know about other states, but I can definitely say that in Utah, my group is 100% in charge of the data that shows up on the coronavirus website. It goes directly from our surveillance system to that website. No other agency touches it. And I am so confident in the work that our local health departments do at getting information into our surveillance system from their case investigations. And then we have epidemiologists at the state level who verify all that data, and then it goes directly to the website. So there is certainly no manipulation on the part of the Utah Department of Health for either inflating or decreasing numbers. The numbers are as accurate as they possibly could be for identifying the number of cases reported to the Department of Health.
Thanks, Dr. Dunn. Here's a question. American with Disabilities Act extends protections to exceptions for people with legally and authentic disabilities for not wearing masks. Again, claustrophobic, autistic, or the deaf who can only communicate via lip reading. So, Dr. Dunn, this one might be best with you, but I will mention that we've requested of the council this week a significant amount of funding that was a request from community partners for clear masks for just that purpose. And we talked about that at the beginning of the hour. Do you want to add anything about the exceptions?
Yeah, there is certainly within the mask order for schools a clause about exceptions. And it does specifically say that individuals who have health issues that could prevent them from wearing a mask safely certainly don't have to. So that is in there. If you have any concerns of whether or not you or your loved ones fall into that category, certainly talk to your healthcare provider. We want to make sure that all of our recommendations and guidelines out there certainly are safe and have exceptions for those where it might not be.
Okay, are there any concerns about how the testing numbers, which are down, are influencing our perception of the positive numbers, especially since the positivity rate is still high?
Yeah, so we were testing a lot of people about 6 weeks ago, I would say. We were in the 8,000 people per day range. That's also when we were seeing our peak of cases. Right now, we're back to testing around 4,000 to 5,000 individuals a day, and that's where we have been for the rest of the pandemic. So it definitely makes sense that the more cases you have, the more close contacts there are, and the more testing is needed. I will say that this is something that we as epidemiologists at the Department of Health keep a really close eye on, because we don't want our dropping numbers to be due to people not getting tested when they should. So I will tell you that our cases are decreasing faster than the testing numbers. So while we have been testing less, and we certainly want any individual out there to get tested if they have mild symptoms, I do think the drop is real because it has dropped quicker than the testing has dropped.
And I'm just going to push a little bit further and say, and you could correct me if you don't think this, but that is in huge part to the mask mandate in Salt Lake County.
Yeah, absolutely. I mean, Salt Lake County, because it is our most densely populated area for the entire pandemic, has had the most number of cases for the state, and they've dropped quicker than any other jurisdiction, specifically after the mask mandate. So there's definitely a strong correlation there.
Put your masks on, people. What sources do you recommend for combating the mental health issues as part of staying home? Oh, for sure. And as a parent, and Dr. Dunn, I know you're a parent too. We've been home with our kids since March, and public school parents like myself looking at the online only situation, like that creates its own mental health issues for families. And then there's the isolation and loneliness of people who need that social connection for so many different reasons. And our elderly also being at home and isolated. We know that there are mental health issues at almost every age and stage of life from the isolation of staying home. I'll let you speak, of course, to the medical side of it, but I'll say that Salt Lake City we've tried really hard to maintain access to recreation in the city. And you know that we did the street closures, or rather the pedestrian openings of many of our streets at the latter part of spring and early summer. And some of those streets are still open to pedestrians and closed to non-local traffic. So getting outside is a big deal. And it's hard not to have some worry about the winter coming. And it's one thing to balance, the pandemic and all the issues it presents to an individual or a family or a community by going outside and sitting in the sun for a bit. But thinking about winter coming, help us out, Dr. Dunn.
Yeah, I think this is something that has been on the front of my mind and the Department of Health mind since the beginning of this, since we started stay-at-home recommendations. I think it's really important for everybody that's not at high risk to know their family members and friends that maybe are, and reach out to them virtually, right? It's not social distancing, it's physical distancing. So make sure you're picking up that phone, doing a video call, chatting. It's really important that we take care of each other. I think, getting outside is important, and especially as winter comes, I think we still need to do that. And of course, make sure you have all your winter gear so you stay safe and warm as well. This is something that we're going to have to keep doing for the next several months until we get a vaccine. So really taking care of each other and figuring out ways now on how to do that safely is going to be very important. For those suffering, maybe more severe mental health, like depression or anxiety, it's really important to reach out to your primary care provider. All health systems at this point in Utah, at least, are providing that telehealth service. So that is a key resource. And then, of course, 211 has great resources as well in terms of being able to reach out for help if you can't find it other ways.
We can't say enough good about calling 211 for almost all of the needs and concerns that we brought up on this hour together.
Yes.
Okay, who can tenants turn to if they're being evicted? Well, first, please try to communicate with your landlord. If you can't resolve it that way, 211. And 211 is the connection point for, as I said earlier, that $20 million statewide that the legislature put together in June for rental and mortgage assistance. It's also the connection point for city investment. So that is a big deal, and it is multilingual. Another one, we'll do a plug for our own website, slc.gov/COVID. There's a list, an FAQ list, and the tab there's one that says, what if I can't pay my rent or mortgage? And it has a lot of resources on there. So maybe one of our people can pop that into the chat if they haven't already. I'm not seeing another question, but we are about 3 minutes from the end here. Come on, people, give us one more. Well, maybe we will wrap it up. Thank you for joining us today. Dr. Dunn, you are a rock star. I hope that the governor erects a statue of you at the end of this pandemic and doesn't wait until the end of your career to do it, because you've brought an incredible amount of confidence and hope, I think, to the people. And as we look into the winter of the unknown of what's coming, I feel so confident in you leading that dialogue for us as our state epidemiologist. So I think you're fantastic. And our
Thank
people
you.
watching do too. So before I go, I want to remind everybody watching about our Ebt Sign Up. And that event is tonight. It's at the City and County building from 4 to 8 p.m. The deadline to sign up for Ebt is August 31st. And it will provide a one-time payment of up to $308 for each eligible child to families whose children were receiving free or reduced school meals, on March 16th when schools ended. So what this is really saying, if your family was getting the free or reduced school lunches and breakfasts before the pandemic, you need to sign up, and you've got to sign up again before August 31st. Or if you're now in a situation where you believe you would qualify, you can sign up too. So down there at City Hall, 4 to 8 p.m. today, the deadline to sign up is August 31st. We will try to answer any questions that we might have missed in the comments with follow-up from our team. So thank you for being with us today, and thank you to Dr. Dunn.
Thank you.